Hip bone is an innominate bone. It is a large irregular bone. It has three parts: ilium, ischium, and pubis. Coming to the side determination, it has pubis antero-inferiorly, just in front of the obturator foramen, ischium posterior-inferiorly, acetabulum facing laterally. Above the acetabulum is a flat extended part of the bone called ilium. This ilium has three borders: anterior border, which falls into the acetabulum, behind posterior border, which falls into the greater sciatic notch, medial border. Between anterior and the medial border is iliac fossa. Behind the medial border is sacropelvic surface. And dorsally, this part of ilium is called gluteal surface or dorsal surface. Between anterior superior iliac spine and posterior superior iliac spine is the iliac crest. Now coming to pubis, it has body of the pubis, superior ramus and inferior ramus. Between two ramus is the obturator foramen. Behind we have ischium. So this inferior ramus is otherwise called ischiopubic ramus. Now coming to the anterior border, anterior superior iliac spine, notch, anterior inferior iliac spine, acetabulum. These are the features on the anterior border. Posteriorly, posterior superior iliac spine, notch, posterior inferior iliac spine, greater sciatic notch. Above that is preauricular sulcus. This is ischial spine, lesser sciatic notch, below ischial tuberosity. Coming to the attachments, anterior superior iliac spine gives attachment to inguinal ligament which extends to the pubic tubercle. The anterior superior iliac spine gives two attachment. One is sartorius, other one is inguinal ligament. Anterior inferior iliac spine gives rise to iliofemoral ligament and straight head of rectus femoris. Reflected head is just above the acetabulum. This is iliac fossa, which gives attachment to iliacus, sacropelvic surface. Upper rough part is called iliac tuberosity. The lower pinna-shaped structure is called auricular surface. Just below that is a depression called preauricular sulcus, which gives rise to sacropelvic ligament. And this is dorsal surface. 5 cm from posterior superior iliac spine to the greater sciatic notch is posterior gluteal line. 4 cm from anterior superior iliac spine to the greater sciatic notch is anterior inferior line. From inferior spine to the greater sciatic notch is inferior gluteal line. So behind posterior gluteal line is maximus, between anterior posterior is medius, between inferior anterior is minimus. Just below the inferior gluteal line we have reflected head of rectus femoris just above the acetabulum. Between anterior superior iliac spine and posterior superior iliac spine is called iliac crest. Behind the anterior superior iliac spine, in the outer border, there is an elevation called iliac tubercle. Then the entire iliac crest is divided into ventral 2/3 and dorsal 1/3. Coming to ventral 2/3, we have outer lip, intermediate area, and inner lip. This iliac tubercle gives rise to iliotibial tract. From anterior superior iliac spine, just 5 cm behind, it gives attachment to tensa fasciolata. To the outer lip, there is insertion of external oblique abdominis muscle and latissimus dorsi origin. To the intermediate area, we have internal oblique abdominis throughout. To the inner lip, transverse abdominis muscle and quadratus lumborum. This is all about ventral 2/3. Coming to dorsal 1/3, the vertical ridge divides the dorsal 1/3 into lateral slope and medial slope. Lateral slope gives rise to gluteus maximus, medial slope erector spinae. We can see this gluteus maximus also extends to the dorsal surface behind the posterior gluteal line. This is about the attachments of ilium. Now coming to pubis, we have body of the pubis, superior ramus, inferior ramus, obturator foramen. Now coming to the body of the pubis, we have superior border, inferior border, anterior surface, posterior surface, medial surface to form pubic symphysis. The superior ramus has pecten pubis part or superior border from pubic tubercle to iliopubic eminence. This iliopubic eminence gives rise to psoas minor if the muscle is present, and this is anterior border towards the obturator foramen, inferior border which forms the boundary of obturator foramen. Between anterior border and inferior border is obturator surface. Between anterior border and superior border is pectineal surface. Between superior border and inferior border is pelvic surface. This inferior border forms upper border of the obturator foramen. Now coming to the body of pubis, medial surface forms pubic symphysis. Upper part, that is superior border, has pubic crest. Laterally it ends in pubic tubercle. Medial part of pubic crest gives rise to medial head of rectus abdominis. Laterally lateral head of rectus abdominis plus pyramidalis. Pubic tubercle gives attachment to inguinal ligament which extends to anterior superior iliac spine. So from pubic tubercle, this extension is called superior border or pecten pubis, which gives attachment to pectineus muscle and pectinate ligament of Cooper. Iliopubic eminence gives attachment to psoas minor if present. Coming to the anterior surface of body of pubis, here at the angle between superior border and the medial surface, it gives attachment to adductor longus. Just below that is gracilis, and below that is adductor brevis. Adductor magnus, it takes attachment from the ischial tuberosity and extends into the ischiopubic ramus medially. Now to the anterior surface of pubis we have adductor longus, gracilis and adductor brevis. This is obturator foramen. Outside of the foramen is the attachment of obturator externus. So from above downwards we have obturator externus. Just below that we have medially gracilis, below brevis, and adductor magnus laterally from the ischial tuberosity. This pelvic surface is crossed by round ligament in females and ductus deferens in males. We have seen the structures attached to outer surface of ischiopubic ramus. Now to the inner surface. There is a lower ridge or lower border, and there is a ridge in between, and upper border which is the lower part of obturator foramen. This lower part gives rise to Colles fascia, and this ridge gives rise to perineal membrane. Between these two structures, this is related to superficial perineal pouch which gives attachment to superficial transverse perineal muscle. Above the perineal membrane, this part gives rise to deep transverse perineal muscle, and above that is attachment of obturator internus. This is obturator canal, where it gives passage to obturator nerves and vessels. Now moving on to ischium. This part is called ischial tuberosity, which is divided by horizontal line into upper quadrangular part and lower triangular part. Upper quadrangular part is further divided by oblique ridge into superolateral part towards the acetabulum and inferomedial part. Lower triangular part by vertical ridge into lateral part and medial part. Superolateral part gives rise to semimembranosus, inferomedial semitendinosus and biceps femoris. Laterally it gives attachment to rectum magnus. Medially there is no muscle attachment. This rectum magnus, it extends towards the ischiopubic ramus medially. So this rectum magnus has two parts, ischial part, which is a hamstring part, and this is non-ischial part. This part above the ischial tuberosity on the dorsal surface gives attachment to quadratus femoris. This depression is called preauricular sulcus, just below sacropelvic surface. It gives attachment to piriformis. The piriformis is considered as a key muscle because there are structures above and below the piriformis. Above we have superior gluteal vessels and nerves. Below, that is the structure passing through the greater sciatic notch, are inferior gluteal vessels and nerves, posterior cutaneous nerve of thigh, sciatic nerve, now to quadratus femoris, and to this ischial spine. The structures are related to the dorsum or pin structures, pudendal nerve, nerve to obturator internus, internal pudendal vessels. So this ischial spine gives attachment to sacrospinous ligament. The pin structure winds around the dorsum of the ischial spine and enters the lesser sciatic notch. This lesser sciatic notch, it gives passage to tendon of obturator internus muscle. Above we have superior gemellus and below we have inferior gemellus. These three structures are attached to medial surface of greater trochanter of femur. I repeat about ischial spine. Ischial spine, which is between greater sciatic notch and lesser sciatic notch, it gives attachment to sacrospinous ligament. Ventral surface of the ischial spine gives origin to levator ani muscle. Dorsal surface is related to pin structures, pudendal nerve, internal pudendal vessels, nerve to obturator internus. Now moving on to acetabulum. It is a cup-shaped fossa. 2/5 is contributed by ilium, 2/5 by ischium, 1/5 by pubis. There is the articular smooth surface called lunate surface, non-articular surface just below the lunate surface, and this part of the acetabulum is connected by transverse acetabular ligament. And this is all about hip bone. Thank you.